Namaste Javins, myself Javin Dr.Barkha Khurana. Today in biomechanics and kinesiology, we will be talking about planes and axes. Before that, we'll talk about anatomical position, which is a position for reference for all the movements of the body. And it is also called as standing supine position. In this picture, you can see the anatomical position of the human body. Now we'll talk about the planes. We have cardinal planes, which are three imaginary perpendicular reference planes that divide the body in half by mass and present where the axial skeleton takes place. Next is the parallel plane. Now, they are the imaginary surface where the movement of appendicular skeleton takes place. And the diagonal planes are the planes other than the cardinal and parallel planes, and the movement occurs in a diagonal pattern. Now we will be talking about cardinal planes in detail. The sagittal plane is the first one, which divides the body into left and right halves. The frontal divides the body into front and back, whereas the transverse divides the body into upper and lower half. The sagittal plane allows forward and backward movements like flexion, extension, dorsiflexion, plantar flexion of ankle joint. The back flips and front flips are whole body sagittal plane movements. Then next is the frontal plane movements, which are the sideward movements or vertical movements. They include abduction, adduction, lateral flexion, elevation and depression of shoulder girdle or scapula, radial deviation and ulnar deviation. Here you can see the diagrams. Here is the elevation depression of scapula, lateral flexion of the trunk, next is the transverse plane movement, which are the horizontal movements. You can say rotations, as in skaters or dancers, like medial rotation, lateral rotation, left or right rotation of the trunk, supination, pronation, transverse, flexion and extension. These all are included in the transverse plane movements. Here you can see the diagrams. Then we have diagonal plane movements like pronation of subtalar joint, which is a combination of abduction plus eversion, and supination of subtalar joint, which is a combination of adduction plus inversion. Here you can see the diagrams. Apart from that, we have reference axes also, which are the imaginary points through which a joint is attached to and it passes through the joint. We have frontal or mediolateral axis, sagittal or anterior-posterior axis, and longitudinal axis. The y-axis is perpendicular to the transverse plane, and here you can see the diagram of the given y-axis. Then is the x-axis, which passes from side to side. In this, rotation sagittal plane takes place. Y-axis passes from top to bottom, and rotation in transverse plane takes around y-axis. Then is the z-axis, which passes from front to back, and rotation in frontal plane takes place around z-axis. So this is all in this session. I hope you understood this session, and if you have any doubts, you can post a comment. This session is powered by Digital 2.0 version of Jayoti Vidyapeeth Women University. Thank you.